Today is October 15th, which means that it is Pregnancy and Infant Loss Remembrance Day. I've been a labor and delivery nurse for 5 years now, and since the very first year that I became a labor and delivery nurse, I have been helping families go through pregnancy and infant loss. And to this day, it is one of the hardest things that I have to watch someone go through. And as a nurse, I do love supporting people during this time. One of the reasons why I became a labor and delivery nurse was because I loved being with people and families on such an important day in their life, the day that their child is born and brought into this world. And that doesn't change for loss. I feel the exact same way. It's a privilege to be there and to be able to support people through the worst day of their entire life, and to hopefully be able to hold their hand and give them coping mechanisms and things that can make them feel slightly better during such a horrible situation that I wish no one had to go through. I think that not a lot of conversations are had about this because it is such a hard topic to talk about, but it is something that a lot of women go through. 1 in 4 women will experience miscarriage in their lifetime, and that is actually a very high number. If you have 4 friends, 1 of them will most likely experience a miscarriage, and that's why I want to talk about it. I want people to be prepared so that if this does happen, you know how to take care of yourself or your friends, and you might feel a little less alone and a little less scared. So one of the things that I absolutely love and cherish doing for my patients who are going through pregnancy loss is giving them memories. And that is to make sure that you go home with photos of your baby. You go home with a piece of their hair, if they had hair. You go home with handprints, footprints, any kind of prints we can get, we will get, and molds as well. So we can actually do molds of their hands, their feet, their legs, anything you want. And of course, we do this with your permission only. We love to do this because it gives you the chance to remember your baby and to bring something home with you. One of my close friends, labor junkie RN, Sarah, she has this saying where she will always remember her patients who went home with a box instead of a baby. And I wholeheartedly agree with this, but if I can fill that box with as many things as I possibly can, I will.